Up until now, those suffering from back pain had only three basic options. They could live with the pain, they could try to mask the pain with prescription medications, or they could take their chances with surgery. But all that is now changing with the scientific advancement of a new non-surgical procedure called spinal decompression, made possible through the development of a new technology called the DRX9000 Spinal Decompression System. In very simple terms, the DRX9000 allows the patient to rest comfortably, even fall asleep, as it gradually relieves the pressure between discs and allows the back to begin a natural healing process. The DRX9000 is non-surgical, non-invasive, and for most people, it's a very comfortable and relaxing experience. So who is a candidate for the DRX9000 spinal decompression system? Well, if you're suffering from a herniated disc, degenerative disc, bulging disc, or sciatica or general lower back pain associated with those conditions, there's a good chance that you're a candidate for treatment on the DRX9000. And joining me now is one of the leading neurosurgeons in the country, Dr. Robert Hudgens out of Presbyterian Hospital in Dallas. Dr. Hudgens, thanks so much for joining us. You have two of these DRX machines in your office. Let's talk about the science of spinal decompression and exactly how it works.
Well, with spinal decompression, what we're decompressing is the disc between the vertebrae. I brought this little model to show that the spine is made up of vertebrae that are stacked up on each other, and between each vertebra is a cartilage pad called the disc. And that disc has a soft center that's sort of 80% water. It's a gel, and that absorbs the force and allows the spine to move in all directions. The outside of the disc is a tough capsule that holds all that together. Well, with time or with stresses, that capsule will stretch and that disc will lose some of its fluid content. And as it bulges out, that puts a stress on the surface of the disc where the nerves are, and that gives back pain. If the bulge or protrusion gets out there far enough, it'll hit one of these nerves that comes off the spine. At each level, there's a big nerve that comes off called the spinal nerve, and it goes right over the back edge of the disc. These nerves come out and join together and form the sciatic nerve that runs down the leg. So when we want to get rid of back pain, we want to put a pull on the spine to pull these vertebrae apart to reduce the pressure within the disc. That's the decompression. That allows the disc to settle back into place. It lowers that pressure so that fluid flows back into the disc and restores the height of the disc. Nutrients go into the disc, and it's a way of repairing it without any type of invasive surgery.
Is it a short-term fix or is it a longer-term fix?
No, in my experience, this has been holding up long-term quite well.
And avoiding surgery for a lot of patients?
Yes, a lot of patients that I see are actually sent for surgery, and I've given them this alternative, and in a great majority of cases, it's let them get rid of their pain without having to have surgery.
Now, as you've heard, the DRX9000 is changing the lives of thousands of back pain sufferers. And it's also opening the eyes of leading doctors and orthopedic surgeons across the country who are finding the DRX9000 to be a safe and effective alternative to back surgery.
Pain getting better?
Better.
The results that these patients are getting from this treatment, they're life-changing. Saving these people from back surgery, being able to go back to work, get their life back in order, being able to become active again, where in the past they've been on drugs and they've been tired of being on drugs and don't want that kind of treatment anymore, and certainly don't want surgery.
Dr. Terry Yoakum is a renowned radiologist. His textbook, The Essentials of Skeletal Radiology, is used in hundreds of chiropractic and medical schools all over the world. The technology of the DRX9000 caught his attention when he saw the MRI of a patient who had a very large and painful disc herniation. But after treatment on the DRX9000, a second MRI showed that the herniation was completely gone, and so was the pain. Dr. Yoakum says he'd never seen anything like it.
I had never seen this kind of resorption of disc material in all of my years of reading scans. It was absolutely phenomenal.
And because of results like this and the relatively high failure rate, cost, and possible complications of invasive back surgery, Dr. Yoakum and hundreds of other prominent doctors around the world are now recommending the DRX9000 as the primary first step for treating back pain.
As the results speak for themselves, there will be a change. The patients will demand it. The patient's not going to want to have surgical intervention Why would you want to have steroids, put into your back, run the risk of getting an infection? As a patient, I would certainly want to avoid that. And the DRX9000 provides them that conservative option for this kind of treatment.
I have patients who I would bet would go to surgery after looking at their MRI and examining them. And they come back telling me that after 2 sessions they were better, and after the completion of treatment are completely pain-free. You can't argue with that kind of success.
I was as skeptical as anyone, and I'm going to tell you that I wish I could take credit for bringing it to our practice. I didn't. One of our other physicians did, and as we learned more about it, I think we all grew to use it more and more. Again, I was as skeptical as anyone, but I've seen the results, and the results are very favorable for an awful lot of people.
And joining me now is another very highly respected doctor, Dr. Louis Crespo. Dr. Crespo is a pain management specialist. He's founder of the National Spine Centers and one of the leading DRX9000 doctors in the country. Dr. Crespo, thanks so much for joining us. For a lot of people, this will be the first time they've heard about the DRX9000 or spinal decompression. Let's talk about the science of spinal decompression, the DRX9000, and exactly how it works.
Well, let's take one step backwards. First of all, we need to find out what is it that causes pain in the spine. The majority of the time, it is a disc that has been injured. A disc is a cushion that sits between the 2 bones in the spine and allows us to flex, extend, rotate. When the jelly in the middle of the disc squirts out and hits a nerve, this will cause pain. With the DRX9000, through a series of gentle pulls, we are able to pull the bones apart, allowing the disc to regenerate itself and also to get the jelly that has squirted out to go back in place.
Now, when you talk about pulls, the natural tendency is to think pulling and some pain. Is this a painful experience for most patients?
No, for most patients, they actually fall asleep on the machine during the decompression process because when they're standing upright, the pain is tremendous because of the pressure on the nerve. As soon as we pull the vertebrae apart, the pain goes away because we take the pressure off the nerve.
And when you talk about hitting a nerve, that can also address the issue of sciatica with a nerve going down your leg?
That is correct, and that depends on what level your disc herniation is. If you have a disc herniated in the lower spine, it will hit the nerves to go all the way down the leg, and that gives you that burning, searing pain that so many people really can't deal with.
Right now, hundreds of doctors around the country are using the DRX9000 and the DRX9000C to help thousands of people with back and neck pain avoid surgery, get off medication, and get back to living an active and pain-free life. If you're struggling with severe back or neck pain, pick up the phone, call the numbers we provided, and see if a DRX9000 doctor can help you. It changed my life, and it could help change your life too. Thank you so much for joining us. I'm Ren Scott. Good luck and be well.